we had had some good regulations in place, we wouldn't have had to do that. The last thing I wanted to sign up for was having to get involved in helping out Wall Street. The last thing I wanted to do is to have to get involved in dealing with the auto industry. The reason that we had to make some of the decisions that we've had over the last several months is because we got in a situation, ironically, that we had too little government, too little regulation. People were taking wild risks, expecting that maybe taxpayers would come back and bail them out after the fact because we couldn't afford the whole financial system to go under. And so people are justifiably, I think, frustrated and angry right now. They've gotten a raw deal, but they need to understand the source of it. It arises because we have not had the kind of serious reforms in Washington that we needed for a long time.
In terms of the health care, what is it I don't understand about this?
Well, why don't you help me through, Dave? What's been puzzling you lately?
If I'm not feeling well,
right,
I go to the CBS nurse.
Everybody should have a CBS nurse, and I'm sure the nurse is a wonderful person. Unfortunately, what we have right now are about at least 30 million Americans who don't have health insurance. So that's a big problem. Heartbreaking stories that I get every day. People who are working, but they don't get health insurance on the job. They're small businesses, they're self-employed. They can't afford to go into the private marketplace because typically those folks get charged 3 times as much as somebody who gets health insurance on the job. So that's one group of folks. Then you've got everybody else, 90%, who have health insurance. The vast majority of the audience has health insurance. Except here's the problem. Your premiums last year alone went up 5.5%, even though inflation was negative. Everything else actually costs less. Healthcare went up 5.5%. So over the last 10 years, your premiums have gone up 130%. Now, a lot of folks don't notice it as much because your employer is picking up a big chunk of the tab, but your employers are noticing it. So what they're starting to do is to drop more people from coverage. They're saying you've got to pay a bigger share of your health care. Insurance companies, meanwhile, are spending all their time trying to figure out how do we drop the people who are sick and might actually need insurance, and let's keep the healthy ones who we're not going to have to pay out for. And so over time, the people who have insurance right now are probably less secure. Their insurance is less stable than it's ever been, and employers are getting hammered, and so they're starting to make decisions. We just can't cover people. If we're on the same path that we're on right now, if we don't do anything about it, then 5 years from now, 10 years from now, far more Americans are not going to have health insurance. Far more businesses are going to say, I can't afford to deal with my employees. And in the meantime, those government programs like Medicare, Medicaid, the VA, Bill Gates, or Bob Gates, my Secretary of Defense, he spends a huge amount of the Pentagon budget just on health care. So if we don't bend the curve overall, we're going to go bankrupt. And the idea behind reform is let's give people who don't have health insurance the chance to buy it, and they can form a big pool so they can get a better deal on it. If you do have health insurance, let's set some rules of the road so insurance companies can't drop you because you have a pre-existing condition or charge you out-of-pocket expenses that are exorbitant. Let's make sure that we are making the overall system more efficient so that, for example, we set up electronic medical records. You don't have to fill out forms 9 times when you go for one visit to the hospital. And let's do it in a deficit-neutral way. That can be accomplished. We're closer than we've ever been, but look, people, this has been one of those things that is symbolic of a lot of ideological arguments. There are a lot of folks in Washington who've got a stake in seeing the status quo stay as it is. And the one thing that I've said is the status quo is unacceptable. We're going to bring about change on this. And when it gets done, just like when Social Security got done or when Medicare got done, people are going to realize this was the right way to go. But it's hard to get there. If it had been easy, it would have been done 40 years ago.
Your job is more difficult than my job. That's what I've learned here tonight. But now, I know whenever you invoke like Great Britain or Canada, people start to shudder because, oh my God, it's socialized medicine. Oh my God, it's socialized medicine. And I'm not a socialist, but it don't sound that bad to me.
Well, it doesn't sound that bad. It doesn't. It doesn't sound bad to Canadians. They're perfectly happy with their system. We got some Canadians here. But look, each country is different. It's not just the Canadians and the English. They've got their own systems. You've got every other advanced nation provides coverage for all of its folks. Some of them do it through the kind of plan we're proposing, which is we help people buy insurance in the private marketplace. Some folks, like Great Britain, they actually control the entire system. Some folks, like the Canadians, they basically run it like a Medicare for all system so that government pays, but it's still private doctors and hospitals. So there are a whole bunch of different ways of doing it. And what we're saying is we can find a uniquely American way to accomplish this. But the notion that the wealthiest nation on earth can still have millions of people, hardworking folks, who, when they get sick, they go to the emergency room or they just don't go to the doctor. And if their child gets sick, they are looking at losing their home or losing their business because they can't afford it. It baffles the mind to other countries. And when I talk to other world leaders who are paying attention to this argument, and they hear some of this stuff, and these are, in some cases, conservative leaders. They're heads of center-right governments. And they don't understand why it is that Americans would not want to set up a system that would save them money over time, would work better, would make people healthier. And I think the vast majority of Americans, they want to see change. But look, let's face it, they're a little scared about the devil they don't know. And so, and there's an awful lot of misinformation out there that gets floated around, and that's what we have to fight through. That's why I end up having to be on the Dave Letterman show. That's
right. You know? But I tell you, the one idea I'd like to see right away are these death panels. If we could get them in place immediately, we'll be right back with President Barack Obama. So men and women, American troops coming out of Iraq after a long, difficult struggle. And now people suggesting more and more American men and women going to Afghanistan. What is that? Well,
first of all, I think that our troops are performing at an extraordinary level in both Afghanistan and Iraq. And Iraq, we are on pace to draw down our troops so that by the end of 2011, we will have our combat troops out of Iraq. And that is an extraordinary accomplishment. And look, Iraq will not be perfect, but thanks to the sacrifices of those who fought, the Iraqis will have an opportunity to create the kind of functioning democracy that I think can end up being a real positive in the region. Now, Afghanistan is a real difficult situation. Here's what we know. The folks who killed 3,000 Americans, they were based in Afghanistan. They've been driven into the foothills and the mountains between Afghanistan and Pakistan. But they're still there. And they're still plotting. And they're still training folks. And they're trying to penetrate U.S. defenses. And although they're weakened from where they were in 2001, they're still there. My central objective is making sure that we take those folks out, that they cannot cause harm to the United States. And so the question is, how best do we do that? Unfortunately, over the last 8 years, or last 7 years, 7.5 years after we went in Afghanistan, our strategy drifted. And we didn't have a clear sense of what it was that we were trying to accomplish. And so understandably, the country is weary of the war. The Afghan people are frustrated that they haven't seen more concrete improvements in their own lives. And what I'm trying to do at this point